So, thanks for the very nice introduction, and thanks to Murat for introducing this topic. I will talk a little bit about our Researcher Mental Health and Wellbeing Manifesto. This is, at the moment, it has been published on Zenodo. This is an open access, open science platform, and has been downloaded over 6,000 times. We also have translations in very many languages. If you follow this kind of QR code, you come to this Zenodo report, but if you scroll down, you will find all of our translations, including into Turkish. This document was written through a process of a lot of consultation with the people within our ReMO cost action. That we held something like 9 meetings with three meetings with each of our 3 working groups, where we discussed at great length with all of our people to assess what the needs were for developing this manifesto, but for supporting researcher mental health throughout Europe. I won't go through all of these points, but we looked at kind of from the researcher viewpoint, from the systemic viewpoint, from the viewpoint of wider stakeholders, and also from the viewpoint of our network. And a lot of this is to determine what will we do within our ReMO cost action and what action needs to be taken outside of the cost action. What do we want our stakeholders to do? So it's a call for transforming the research's ecosystem to benefit mental health and well-being. So that we're trying to build as inclusive a platform as possible, all countries, all types of researchers, but also people working in training, people working in research management, people who are within institutions trying to develop interventions, such as mentoring or career support or whatever it might be, counselling, whatever it may be, and to facilitate dialogue. So we run a conference, we run meetings like this one, we run kind of webinars, any way that we can promote discussion within the network and kind of to bring new opinions into our sphere. We have an open access evidence hub. This is basically a list. It's on the open access platform Zenodo or Zotero, and it's basically a list of literature, but not only academic papers, also reports, best practice initiatives, all sorts of ways that we can gather evidence and kind of show what's going on. That one of the big topics at the moment is kind of reform of research assessment. How we decide who gets grants, which papers get published, who gets hired, and kind of which priorities we have particularly when kind of researchers are hired, because this is something which in different countries throughout Europe is done in very different ways, but nobody seems happy. So I think it's to find out exactly what's best. At the moment, there's a process called COARA, that's the Coalition on Awards and Research Assessment, and that this is something where there is a lot of engagement, but there's also not all of the institutions can sign up, not all have. So I think at the moment we are looking to see how we can interact with COARA, so that research assessment is reformed and that it supports the mental health and career progression of researchers. How kind of research funding is awarded is very important, and really determines which careers get supported and which not, and which research gets done. So I think this is I think we were discussing on the taxi on the way here this morning, if you set a deadline in the middle of the school holidays, that this affects different people differently. I think if you have family, if you have children, then sometimes that the research funders don't see their own role within the research system. Kind of how to foster mental health and well-being institutions. I'll just see my, move that to the side, and kind of through institutional change. That institutions are very complex systems. If you have a university like the Cahill, it's like a huge institution. It's not very, so you can have different research culture in different departments in the same institution. So I think this is a very complex question, but institutions have to take leadership, because generally what we see is that institutions take leadership for improving rankings, for excellence, but they also have a responsibility for employee well-being, for researcher well-being. And so what we plan to do is to create a battery of evidence-based institutional practices. So I think a lot of the work that we're doing, particularly in the conference, is to bring researchers into this field who will then study kind of which practices work, which are evidence-based, and so on. That I already talked about research assessment, but it's also that who is doing the research assessment? It's the institutions, in very many cases. At the moment, the institutions, if they say that the main basis for assessment of researchers is publications and research funding, that means that they outsource the real assessment to the journals, and to peer review, and to the research funders in many cases. So I think this is trying to rebalance it so that the institutions take more responsibility for research assessment. I will let in these two people and then go back. And kind of, I think that there should be a professionalization of doctoral and academic staff training. So I think this means that if we have PhD candidates, that one of the ways that universities see to increase their rankings is to increase the number of researchers, and the cheapest way to do that is to increase the number of PhD students or candidates. And that this is something that has consequences down the line, because the training that PhD candidates get very often prepares them for a research career, and not particularly for a career outside. And if their career outside is going to be in sales, marketing, regulatory affairs, whatever it may be, this is a career they can start with a master's. So I think that the kind of doctoral education needs to be reformed so that it serves the majority of PhD candidates who want make an academic career. And we call for researchers' empowerment. We work a lot with researchers in meetings like this, but also kind of with research organizations, also disciplinary organizations, and giving workshops. And it's just kind of raising awareness that researcher mental health is a topic that has to be dealt with, that we promote bottom-up initiatives, very often raising awareness, but also peer-to-peer mentorship within organizations such as Marie Curie alumni, but also others. That we offer a kind of person-centered and evidence-based approach to training management, so that very often as you progress in your career, and particularly at PhD level, not everybody has the same training needs, and a doctoral training program often provides the same training for everybody. So I think e-learning is definitely going to be something that going forward is going to provide different capacity for institutions to provide the training that individuals need. One of the big issues is supervision, because I think when we're talking about mental health, one of the biggest stressors is when we have poor personal relationships. And if you have conflict within a research group or and it happens, but I think most of the worst problems, particularly for early career researchers, is when there's a very poor relationship with the supervisor. And this it's not always supervisors bad, kind of early career researchers good. I think in any conflict situation there can be different reasons for that. But there should be a way for research organizations and for research groups to solve problems and to manage conflict. And with that, I think that we're probably a little bit that we also published a paper based on the work of writing the Researcher Mental Health Manifesto on well-being and mental health of doctoral candidates, and that came out last year. I have more content, but I think at this stage I will kind of let us catch up on our work today. So thanks very much, and looking forward to your questions.